Hi, my name is Eric Dixon and I'm the President and CEO of UMass Memorial Health Care. At UMass Memorial Health Care, our overarching goal, what we call True North, is to engage every one of our people every day in making UMass Memorial the best place to give care and the best place to get care. We do that work, the engaging everyone every day, here at our idea boards, where teams come together in Huddle and work to solve problems in their area. We're all pretty good at identifying problems, but the difference here at UMass Memorial is we focus on developing people into problem solvers. We focus on execution of the ideas so we don't have deja vu meetings where we talk about the same problems over and over again. When you work here at UMass Memorial as either a caregiver, a manager, or a senior executive, you're expected to get together with your team and to talk about whether you're winning or losing based on performance in your area and engaging all of your people in coming up with solutions to the problems that you face. True North isn't just an overarching ideal, it's a set of metrics that we follow to tell us how we're doing in terms of our improvement journey. We start with patient-oriented metrics always at the top, our people-oriented metrics in the middle of everything we do, our innovative spirit and our discoveries, and our future to assure that for the long term, we're a sustainable organization. When you come together at a huddle at UMass Memorial, you'll be talking about your True North metrics in your area and how you can improve. It's what makes us different. It's at the very core of the culture that we're trying to create, and we hope it'll make it a special place for you to work. Now let's watch an idea huddle and see what happens when teams come together to solve problems in their area.
Hello.
Hello. Welcome to the huddle.
Oh, we got a good amount today.
Thanks, everybody. So it just appears that Mary and Steve are the only ones not here. Who wants to pass on the information?
Okay.
Great. Thanks, Mike.
All right, who wants a huddle stick?
I'll take one.
I'll take one too.
Anyone else?
I'll take one, thank you. Looks like I'm the lead. Who's the timekeeper?
I am.
Great, I need 10 minutes, please. Who's the scribe?
I'm on it.
What a great start to the huddle. Did you notice that the manager didn't lead, that the caregivers stepped up right away and were running the board? What a difference between a meeting that is led by the people that are going to ultimately have to institute those solutions to those problems than a manager just stepping up and doing everything.
Yeah, it's pretty clear that everyone on the team is empowered to lead those kinds of problem-solving discussions. The roles and responsibilities are shared amongst the team, and some of the employees even took back action items to share what happened at the huddle with employees who weren't able to make it.
Okay, first let's review our True North metrics. Looks like we met our patient goals. We made follow-up phone calls to all of our patients from the clinic that were in the ED. Yesterday, we only called 3 out of 7. What did we do differently today?
We put a blue sticky note next to the phone with the patient information on it, and then anybody who had a minute could make the phone calls.
Perfect.
That's excellent. Let's trial it for another week, then we'll come up with a workflow, and let's pass this on to other departments. They may find the workflow helpful as well.
Okay, sounds good. Our people. Looks like 100% of our employees got to go to an uninterrupted lunch break today except for Rick.
Yeah, so unfortunately today there was a very long line at checkout right around lunchtime, and I was the only one there to check these folks out, so I had to split my lunch into 2 15-minute breaks, but I did put an idea on the idea board to try to solve the problem.
Okay, so it looks like for our Discoveries weekly metric, we met our goal of having at least one idea huddle per week. Great job, everyone.
Yeah.
Okay, on to our long-term financial health. Looks like we're still 2 weeks behind on the billing. Are there any updates on this?
Well, I did speak with Jonna about this, and other departments are having the same issue. Jonna's going to be meeting with finance, and she'll get back to us at a later date.
This team does a really good job of connecting what they measure to their idea generation.
I thought that was amazing, how they immediately got focused in on performance metrics that were important to them in their area and are important to us overall in the healthcare system. It's okay to have some ideas that come up and bring some problems forward that are really impacting the unit that maybe aren't related to True North. But if you just do that, or if that becomes the majority of what you're working on, you really lose the focus of the group. And they did a nice job of zeroing in on things that were important.
One of the measures I really liked was making follow-up phone calls to patients, to their patients who visit the ED, which aligns directly to our medical center goal of reducing ED boarders.
And some quality metrics about readmissions and things like that as well. And it's a great example of a local group focusing in on what's important for the system and the impact that they can have overall for the organization.
Now let's talk ideas. Jess, do you have an update on the draft survey?
Yes, so instead of doing a survey, we decided to rate a patient's experience today from 1 to 5.
Nice. What's the next step?
I think we start doing it today.
Is there anyone else we should ask before implementing this?
Maybe the patient experience team?
Yeah, you're probably right. I'll send it to the patient experience team and get some input from them.
Perfect. Thanks, Mark.
The next task up there was mine. It's the idea to use a blue sticky note so that we know it's like a signal to make a call.
Yeah, we started it, and it's working really, really great. I think we should keep going for a few more days.
Okay, sounds good. Thanks, Mark. The next task up here is determine par levels for the linens. Mike, you're the lead on that?
Yes, I contacted housekeeping just to try to get an idea of what other teams are doing, and they're going to go ahead and sit in with us next week at our huddle just to give us some options.
Okay, the last task due today is to make a celebration board. Neil, you and Steve were the head on this.
Yeah, so it's done and posted now. Special thanks to Lauren for watching the phones for us this morning.
No problem, great job.
Yeah, another completed idea.
You know, I love the way they were thinking in terms of understanding a problem fully before coming up with a countermeasure. And that's really the role of the manager, to coach, mentor, and support those frontline caregivers so they become problem solvers. So they don't jump to countermeasures, we should do this. And instead are thinking, we have this problem, I think it's because of this, now let's think about potential countermeasures. That's the essence of moving from a problem identifier to a problem solver. Do you understand the problem fully before you move to that countermeasure? The other thing that I thought was really great in this part of the huddle was they're thinking systemically. So we have an idea, but that's going to impact some other area, or we need to come up with a solution, and there might be somebody else that we could bring to our huddle from housekeeping in this example that can actually help us. That was really terrific.
Yeah, and sometimes we'll come across barriers that we try to eliminate and we're not as successful in doing so. It's the manager's job to attempt to remove those barriers, but when unsuccessful, to escalate those issues to the proper management level.
You know, that escalation process is really important because people can get bogged down by ideas that need help and feel like that they can only change things that they control. We want to have the escalation.
Okay, we have room for one new idea. This one got the most votes. This one's yours, Rick.
Okay, great. So it has to do with the fact that we can't always get 30-minute lunch breaks. Okay, so my solution would be to hire more staff that can, one, help us with checkout around lunchtime, and two, help us at other parts of the day where we can get overwhelmed when it's quite busy.
Yeah, more staff, definitely.
Okay, I understand that it gets really busy at times, but financially we can't have any more staff at this time. So let's think about this differently. Why were you alone at checkout?
Well, unfortunately today, I think the primary reason was I was the only one there and everyone else was at lunch.
How do we determine who goes to lunch?
Well, once it hits 12 o'clock and you finish up with your patient encounter, everyone rushes to the break room, and if you're there with a patient, you're kind of stuck.
So let's find out a new way to determine who gets to go to lunch. Everyone should have an uninterrupted break.
What if we made a lunch schedule so we knew that someone would always be at the checkout desk?
Well, everyone likes to take lunch at 12 o'clock. How would we determine who goes to lunch when?
Would anybody be willing to take an early or late lunch?
Yeah, I wouldn't mind taking a lunch at 11. It would be helpful if maybe we created a rotating schedule so we wouldn't always be at the same time, but I
Yeah.
wouldn't mind giving that a shot.
Yeah, I'm open to the idea if it helps everybody get a full lunch.
Okay, sure. I can create a schedule and we'll see how it works.
Okay, so the first step is to make the schedule.
You know, one of the most common solutions or countermeasures that comes up at the idea boards is let's hire some more staff, let's get some more space. And sometimes that's where we have to end up. We need to bring more caregivers in to solve a problem because we don't have capacity, or we just have used all the space that we have and we really can't solve the problem without additional space. But what you saw this manager do is ask some questions about what's the problem we're trying to solve and get people focused in on solutions that didn't require new capital, new caregivers. Creativity over capital is always what we're looking for, because we live in a resource-constrained environment in healthcare, and it's getting tougher and tougher. So I was very impressed by how the manager came through, asked questions, and people got to the right solution or a better solution that didn't require additional resources.
Yeah, we're asking all of our caregivers for their ideas, but that doesn't mean that we're going to implement every single one of those ideas right off the bat. Some might require some more thinking through, some more structured, methodical thinking about how can we implement this idea the best way to get it truly to a great idea.
Oh, 1 minute.
Anything to celebrate?
Yes, we have a really nice letter that we received from a patient last week, right on our new celebration board. Nice job, everyone.
So next week is the innovation celebration, and the GI clinic's going to be there to share their A3 with us.
Great. John is going to be at the idea board next week, and it'll be a great opportunity to share what we've sent to the Innovation Fund.
Awesome. Thank you, everyone, for making this the best place to give care and the best place to get care.
Woo! Yeah!
It's always nice to end an idea huddle with a celebration.
It's my favorite part of the whole huddle, right? And unfortunately, it's because it comes at the end, it often falls off. And there's, a good manager, a great manager, will make sure that you save some time to celebrate the great work that their people are doing. And they did a wonderful job with the huddle, with the celebration here.
How do you like to see managers celebrate their people?
The best thing to do is to ask the people, if we achieve this goal, how do we want to celebrate? And the people will tell you what they want to do, and then, like everything else, they'll own it. When people come up with ideas, whether it's about how to improve performance or how to celebrate when we've achieved something great, they own it, and that's what we're trying to create here.